the OB that was on call that day was really tired at the end of his shift, and specifically said he wanted to get out of there. So he used 2 forceps to deliver my babies. And I knew nothing about forceps deliveries. It wasn't something I had educated myself on before giving birth. And since giving birth, I have discovered that it is quite a high percentage of women who have forceps deliveries that will then prolapse. And because I had 2 forceps deliveries back to back, 12 minutes apart, I was also given an episiotomy against my wishes. And my placenta was also ripped out of me.
Welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, 2 Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment. Welcome back to Breast Intentions. Today's guest is Robyn Pineault. Her journey into motherhood took an unexpected turn after delivering twins in 2020. What began as a postpartum complication became a years-long fight for answers, culminating in major reconstructive surgery in 2025. Today, she shares her story of resilience, advocacy, and healing.
So on today's episode, we have a very good friend of mine and an old friend of mine as well, back from the fitness industry, I think it was, Robyn Pineault. Welcome to the show.
I'm so excited to be here. Thanks for having me on.
Well, thanks for coming on and also for sharing something that's very intimate and something that is probably has been quite private for you for a while. But I do think that there's a really great opportunity to share your story because there's probably more women out there that struggle with some of the stuff that you've been through, which is prolapse, but we're going to get into a little bit more of like the bigger side of it because, as I said earlier, it's probably more like prolapse on steroids. And maybe if I can get you to introduce yourself and just kind of talk a little bit about what happened back in 2020.
Yeah, for sure. So I am a twin mom of boy-girl twins. So back in July of 2020, I gave birth vaginally to my twins, which is not the norm. Most twin moms opt for C-sections. And you say that I have been dealing with something quite privately, but I actually have been quite public about it on my Instagram, and that's how you found out. So I have been talking for the last, I would say, 3 months about how I would undergo a multiple organ prolapse surgery, which is the result of the wonderful birth of my babes. So back in 2020, I really, really wanted a vaginal birth. One, I wanted to experience it because this was probably going to be my one and only pregnancy. And I believe in the health of a vaginal birth for the babes. And so I was very adamant and I gave birth in an operating room, which is the norm in hospitals if you're having a twin birth. So I gave birth in an operating room. And during the birth, the OB that was on call that day was really tired at the end of his shift, and specifically said he wanted to get out of there. So he used 2 forceps to deliver my babies. And I knew nothing about forceps deliveries. It wasn't something I had educated myself on before giving birth. And since giving birth, I have discovered that it is quite a high percentage of women who have forceps deliveries that will then prolapse. And because I had 2 forceps deliveries back to back, 12 minutes apart, I was also given an episiotomy against my wishes. And my placenta was also ripped out of me. So that's just like perfect storm for multiple pelvic floor traumas within a very short amount of time. And then I also had to have a D&C, I would say a week later. So I was in the hospital for 2 weeks. They couldn't figure out why I was in so much pain after giving birth. And they finally did an ultrasound, I want to say like a week after I gave birth, and found out that there was still retained placenta inside. So I also had to have a DNC. So yet again, more pelvic floor trauma. And so that resulted in a vaginal wall prolapse. I would say about like a week or two after I got home from the hospital. So I was in the hospital for 2 weeks at home. And then all of a sudden, I think I stood up and I thought my uterus was falling out of my body because there was like a golf ball amount of, let's just call it skin. I didn't know what it was that was coming out of my vagina. I remember standing there and like yelling at my husband to come see. And we immediately went to the ER where I found out, the ER doctor told me it was a vaginal wall prolapse. And I should go to physiotherapy and there's nothing he could do. So that is the long story short of the birth resulting in what I've been dealing with for the past 5 years now.
Right. Oh my gosh. Okay. So with the forceps and the episiotomy being used during the delivery, and so I guess you were saying that it was 3 weeks after that you felt that something wasn't right, or it was immediately after that you felt something wasn't right?
No, it was like 2 weeks after. But like the vaginal wall prolapse presented itself fairly soon, 2 weeks after we got home from the hospital. I'm having this like golf ball size amount of skin protruding outside of my vagina.
Was that the first time that you noticed something felt off?
Yeah, like it was completely fine. And then I just stood up and I felt this like downward pressure. And there was like this golf ball size amount of skin. And I thought my uterus was falling out of my body.
How was it explained to you when you went to the hospital?
So I thought it was a uterine prolapse, and I used those words when we got to the ER, saying like I just gave birth to twins, and I gave them the whole history. And when I was examined by the ER doctor, he said, "Oh, it's just a vaginal wall prolapse. It's just this side of your vaginal wall coming out." And it wasn't explained to me at all at that moment that organs could be pushing the vaginal wall out. I didn't discover until 2025 what a prolapse actually is. So I went about, they told me, go pelvic floor physiotherapy. I had been doing pelvic floor physiotherapy leading up to the birth because I had actually been seeing a pelvic floor physiotherapist when I was an obstacle course racer pre-kids. So I knew I had a tight pelvic floor. And so I was getting therapy to prepare for birth. And then I was getting therapy while I was pregnant. And so I went to see a pelvic floor physiotherapist. However, I also gave birth in the middle of a pandemic. So I had limited access to care. And when I did finally see a pelvic floor physiotherapist, I was taught strengthening exercises, so breathing exercises. I don't call them Kegels, but like holding your pelvic floor up. And it just kept getting worse and worse. And so I gave birth in British Columbia, in Canada, and then we moved back to Ontario. And then I had to rebuild my healthcare team. And so it was about like a year later from the time of the first prolapse that I finally got some care. And so I asked my family doctor, because I had done all this research, to get fitted for a pessary. And so I knew the importance of potentially getting a pessary to hold everything back up while I was strengthening or while I was working out, because I'm still, like, we know each other from our fitness competition days. I'm still lifting. I'm still, trying to stay very strong. And so I was fitted for a pessary, and it didn't seem to work.
So what's a pessary?
A pessary is, actually should go get it. It's, I've never worn a diaphragm, but my understanding it's like very similar to a diaphragm. It's a circular device that like you can fold it in half and you insert it and then it flips open and it literally can like lift everything up. So for those who are watching on video, if you have any organs prolapsing, it will hold everything up while you're walking or running or
because
lifting.
Otherwise, is it just hanging out? Yeah.
It's just hanging out. And my understanding from all of the pelvic floor physiotherapy visits that I've gone to over the years is they used to grade them. So they actually can no longer grade them. Only a urogynecologist can formally grade them now, but there's 4 grades. So grade 1 is it's slightly protruding. Grade 2 is slightly worse. And so at the time I had like a grade 2 prolapse, and it got worse than a grade 4. So I started talking about preparing for the surgery, and the reason why it's no longer like private information is one of my videos on TikTok went viral to 1.3 million viewers, listening to me describe that I had about this much sticking outside of my vagina. So for those who are listening audio, like take your thumb and index finger and hold it as wide open as possible. So I found out quite later that I had not only my bladder, but my uterus and my rectum all protruding outside of my vagina.
Which was originally told to
So-
you that it was the vaginal wall, and like he just said it like it was like, it's just your vaginal wall. Go get some physiotherapy. You'll be fine.
It might really have been just the vaginal wall at the beginning, but over the course of the next, so this was 2020, over the course of the next 4 years up until 2025, it got slowly worse. And so I actually wasn't able to wear the pessary. Every time I would put in the pessary, I would get uncomfortably constipated, and I've never been constipated in my life. So something would happen with my organs internally to cause constipation. So I never wanted to wear it. Also, I would put it in. So I specifically put it in because I used to be a runner. I absolutely loved running. I was an obstacle course racer, a trail runner. I would run 5 kilometers a couple times a week with my dogs. And I would try to put the pessary in, and I would walk out of the house and I would immediately pee myself. And so it was probably not fitted properly for my body. I've come to know that there are different types of pessaries, and I wasn't really given those options. And I never went back to my physiotherapist and said, it's not working. I just kind of it's not working. I'm not going to use it. So that's on me. Like, I could have tried to find different options, but near the end, nothing would hold anything in. Like, when I say I had this much sticking out of my vagina, there's no way that pessary was going to hold anything in. So it just got too bad.
I have so many questions. And they're actually not even on this list because it just unraveled. So for anyone who is listening, how do you define a uterine prolapse, a vaginal wall prolapse, all of the different prolapses, and what is the most common one?
Yeah, my understanding is that the most common is the bladder. So the bladder will actually push down, and part of the bladder will stick out and come into the vaginal wall or vaginal area. The next one that's also quite common is the rectal. So when I was looking for research, when I was preparing for surgery, I was trying to find other women that have undergone this surgery, and I couldn't find anyone that has had all 3. I had only been able to find someone that had a cystocele, which is a bladder repair, or a rectocele, which is the rectum repair. So those I could find information about. And the way that those are fixed is you go in through the vaginal wall, there's a large incision, and they will go in and kind of put your bladder and your rectum back into place. And so those my understanding from my research are the most common. But what I found out, so there was twice that I raised my hand. So I raised my hand in 2021, and I actually went into a hospital in Ottawa and saw a urogynecologist. And at this time, I was of the mindset that I had a vaginal wall prolapse, and I could strengthen my vaginal wall muscles, and I could fix everything. And so I had this mindset that I didn't need surgery. I was not going to ever need surgery. I could fix this myself. I'm pretty stubborn that way. And so I had just asked, I'm I want to be fitted for a pessary. And the urogynecologist said, unfortunately, we don't do pessary fittings. You have to go see a pelvic floor physiotherapist. they gave me some recommendations. And they said at that time, they said the majority of prolapses have to be fixed with surgery. And I was like, what are you talking about? Like, this just doesn't make sense. But they didn't present me with my surgical options at that time. And they didn't tell me, like, I also don't think they examined me. I don't think they actually looked at my prolapse to see what it actually was. And so if they had maybe examined me, they might have seen what organs were coming out. Because when I raised my hand I raised my hand in 2024 with my family doctor, and I said, this is getting so bad, and I'll explain why it was so bad. And I said, let me talk to a urogynecologist about my surgical options, because I came across some research that if my uterine ligaments had been damaged during birth to a point where they were torn, there was no way I was going to be able to strengthen my muscles. And so I came to an understanding that damage might have been done, probably was done, it's hard to tell, during the birth. And I was never going to be able to fix the prolapse because of how extreme my situation was. My situation is very extreme. There are not a lot of twin moms that give birth vaginally with forceps delivery. So like, as I've been sharing it, everyone and their sister on TikTok is like, oh my gosh, new fear unlocked. I'm like, that's only if you have twins and you opt for a vaginal delivery. Like, let's just remember the situation. So it is important to kind of tell my birth story. But when I finally got a urogynecologist consult a year later, because it's a year waiting list here in Canada, when I went in, I saw a fellow, she examined me and she's like, and I said, I have a vaginal wall prolapse, open my legs for her. And she's like, no, you don't. You have 3 organs hanging out of your body. And I had no clue.
This is
this
years
entire
later.
time.
Wow.
4 years later. So 2000, I saw the urogynecologist in May of 2025. And so this is 5 years basically from the birth of the twins. And I'm finding out that I have 3 organs hanging out of my body. And this entire time, I just thought it was the vaginal wall protruding more and more. So there's just such a lack of information about this. Women don't talk about it because it's your vagina. Nobody talks about your vagina. And like, I have stuff hanging out of my vagina. So it's not, now I'm like, I've talked about it so much. I'm probably a little like, I'm okay with it. But like, this is not something you bring up at a party.
Hey, how did all of this impact? This is probably a very loaded question, but how did all of this impact your life? Like, could you jump? Could you sneeze? Could you cough?
Yeah. So luckily with the prolapse, I had no incontinence because everything hanging out was pressing on my urethra. So as everything's like hanging out, it's pressing on the urethra. So I technically had no problems working out. Like, it's very hard to run with that much stuff hanging out of your vagina. So like running kind of became something that I couldn't do. I remember filming, it was the phase of Instagram where the wives were doing like can you get away from your husband in like a foot race? And I remember like trying to run away from my husband, and the prolapse was so bad that day. I was like, oh, I'm going to retry this once everything is fixed. But like, just running was out of the question. Working out was really hard. So even doing squats, lunges, I had to be very careful about how I brace my core and lift my pelvic floor so that the prolapse doesn't get worse. I talked about it on TikTok, but like, sex was awkward. We still had amazing sex, but sex is awkward when you have to shove your uterus back into your body before you put the penis in. So like, there's just like, it's just awkward. And it got to a point, the reason why I finally raised my hand was I was having trouble completely voiding my bladder, and I was actually having trouble with bowel movements. So it was just, I was having trouble voiding completely, which is just not a great quality of life to have.
Right. So on top of it being physical, as in like limiting, or somewhat limiting, how was it mentally and emotionally?
Well, I think, and I've talked about this before, in like my birth story, I used to have my own podcast and I shared my birth story publicly. And something that was really hard was I gave birth to twins and then I went into survival mode. I went into, I'm trying to keep two humans alive. I'm trying to figure out how to breastfeed two babies at the same time. I'm in a lot of pain from the episiotomy and the vaginal delivery. And so I was just going into healing mode. And then because of the 2 week stay in the hospital, me and the babies actually got thrush. And because it's the pandemic, I wasn't getting proper after birth care. So I had thrush for 3 months post coming home. And I was miserable because I was trying to breastfeed the babies, and every time they would latch, it was shooting pains in my boobs. And I was just like screaming in pain. I was crying. I thought it was normal. So I thought I just thought breastfeeding was uncomfortable. And I didn't share this with anyone. I finally went into like a 2 month post-op appointment with an OB. And she was checking my episiotomy, seeing how it was healing. And she just asked me how I was. And I broke down crying, saying that like breastfeeding was so painful. And she's like, may I take a look? And she looked at my boobs and she looked in the baby's mouth and she's like, you have thrush. Like and I was like, I don't know, what's thrush? I had no idea. And so mentally I was just like, I was worn down. I wasn't even thinking about my prolapse because I'm trying to figure out breastfeeding for two babies. And so, I think if I had had a different situation, if I had had different types of care, I might have discovered things earlier. I might have been able to address things earlier, but I just kind of like, I was like, oh, the prolapse is there. Like, I'm going to try to do my strengthening exercises when I'm sitting breastfeeding, but I wasn't getting regular physiotherapy care to try to make it better. So like, it just kept getting worse. And then life gets busy, and it's one of those things where like if you don't prioritize taking care of it, it can get worse, especially if you're lifting. So I was lifting, I was trying to get back to 3 to 4 workouts a week, and I love my squatting, I love my lunging, and deadlifting. So like, of course, that's going to cause downward pressure on your pelvic floor.
Did you struggle with depression and anxiety?
Yeah. So after the birth, I would say the first year after the twins was probably the hardest, especially when we were living out in BC because we did not have any family and we had no community. And we couldn't find anyone that was like-minded. So we were really struggling as like a family unit. And I remember one day telling my husband that while he was at work, I pictured when he got home, walking out of the house and never coming back.
Oh, wow.
So that was probably like my lowest moment, but I vocalized it to him that I was having these feelings. And we immediately got help. So I was able to get talk therapy, which is, I don't want to knock talk therapy, but like it was what I needed at the time. I have come to learn that like talking about your problems and talking about negative things consistently just keeps you in that kind of area. I wish I had been able to like voice more like, here's what I need in terms of support. Like I need someone to come and help me with laundry, or like I need someone to come and clean the house. I wish I had been able to voice that at the time, because that's really what I needed, as I was trying to control everything. So because I lost control during the birth, because the forceps were not something I wanted, the episiotomy was not something I wanted. So I lost control during the birth. Afterwards, I just tried to control everything. The laundry had to be done my way. I had to fill the dishwasher my way. And I just needed to control things. And if I had been able to talk to someone about relinquishing control of things and like being taken care of, I think that would have helped me so much more. Talk therapy was like the Band-Aid solution, but then it was figuring out how to like relinquish control and surrender to like actually accepting help. So that was, but the postpartum depression and anxiety were very much based on the birth trauma.
Okay.
And I would say, like over the years having the prolapse, it's frustrating. It's been very annoying. I probably have lost a lot of confidence that I had before. I was constantly asking my husband, and I wear leggings a lot because the leggings were so supportive in terms of like keeping the prolapse up. Wearing like loose pants was actually like excruciating because my prolapse would come out of my underwear and then it would just rub. And so I wore leggings quite a lot. And everywhere I went, I would always ask my husband, I'm like, can you see the prolapse?
Oh,
Like,
really?
because it was so, like, it would protrude so much. I was like, does it look like I've pooped my pants? So, like,
Right.
I was probably like, I was moving through life as if everybody knew. And so I've probably lost a lot of my confidence just like thinking people knew I had something sticking out of my vagina, even though like no one knew.
Right.
Yeah.
So, I have so many questions.
A lot to unpack.
Yeah, there is. So you had the surgery how long ago? 6, 8 weeks?
I am 7 weeks post-op as of this recording.
Okay.
So,
And do you feel
yeah.
like your world has changed?
I'm in a lot of pain.
Oh, are you?
Yeah. So healing timeline was not what I expected. I don't know because I couldn't find anyone that had gone through the 3 surgeries in one. I couldn't find any information on healing timelines, and I don't think my surgeon properly prepared me for it. So I've been talking about it quite a lot just to like give, because I've found quite a lot of women through TikTok and Instagram who are about to have this surgery or one of the 3 surgeries. And I think it's because they call it a day surgery. And so I'm like, oh, I'm not staying overnight. Like I'm in and out. This shouldn't be that bad. Meanwhile, some people that have had similar surgeries or maybe 2 of the 3, they're like, no, I was in pain for like 6 to 8 weeks. I was like, oh, like I didn't even think about that. But for the first 4 weeks, I was horizontal. I could barely sit or stand for longer than like 5 to 10 minutes. And the pain is slowly subsiding, but also, so let's talk about the surgery. So I opted for, it's called a hysteropexy. And so when I was presented with the surgical options for the 3 organs, there's the cystocele and the rectocele, so the bladder and the rectum solutions. And then when it comes to your uterus, you're presented with 2 options. You're presented with hysterectomy.
Yeah, I was going to say they can remove it, right?
Yeah. So you're presented with the option of having your uterus removed. It's not common for them to keep the uterus because I've also been told that I'm young. This is a surgery that's done in much older women. And so at that point, you're way past childbearing age. You're probably in menopause. And so keeping the uterus is like, cool, let's get rid of it. Whereas I had a hysteropexy. So they went in laparoscopically through my belly button. And they needed to look at 2 different ligaments. So if my uterine ligaments were okay, they were going to suture the uterus to those. Unfortunately, they were like completely crap, which is like, it makes sense that my uterus was sticking out that much. So they sutured my uterus to my sacrospinous ligament, which is basically in your tailbone. So I have incredible tailbone pain because my uterus is being held up by my tailbone ligament.
Holy.
So
how come you didn't want the hysterectomy? Or was it your choice?
I've been having, it was my choice. And also the surgeon, so again, backstory, when I went in May of 2025 and I was presented with the options, the fellow that I saw recommended that I have the hysterectomy because she said it's much more common that if you don't have the hysterectomy, that you will prolapse again in the future. So prolapse is just like something that I need to worry about. I need to strengthen my pelvic floor and heal properly so that I don't prolapse again. But it might happen again, when I'm in my hopefully 80s or something like that, and they'll go back in and do another surgery if I want it. When I went in, I had to go in for something called UDS testing. So because I live with MS, multiple sclerosis, they were worried that once they fixed everything, I was going to have incontinence issues. So what they do is they do this testing where they fill your bladder with specific measurement tools that they insert because they want to see if there's the right pressure there. And then they actually like fill your bladder, make you like stand up, hold it, walk to the bathroom, and see if you can actually like hold the fluid. Because the other option that I was given, so I was going to actually have something called a urethra sling. So if there was any incontinence issues, they were going to take some of the fascia from my abdomen and actually make a sling to hold the urethra up. Thankfully, I passed the UDS testing with flying colors, so I didn't need that option. But that would have been 4 surgeries in one. So I go in for the UDS testing, and the urogynecologist, the senior one, sees me at that time, and she's like, at 43, you're actually quite young. And I was like, thank you for saying that. I work with a lot of 25-year-olds and don't feel young, so I appreciate that. But she said, because you're quite young, we want to save your uterus. So it was something that like they wanted in addition to, I had actually grieved for a couple of months the loss of my uterus. I thought I was losing it. And then when she said she was going to save it, I was like, great, this is good news. I had quite a lot of conversations with my naturopath about how the uterus is your largest estrogen receptor. And even if you have it removed, keep your ovaries, you can go into menopause earlier than normal. It's not imminent. And I wasn't worried that like I was going to go into menopause right away. But if I'm going to go into menopause at a certain time and it would be earlier, of course I want to avoid that. Like who wants to go into menopause earlier than what their body is supposed to do? Right. So that's why we kept my uterus.
I guess, knowing that you now have to have 3, possibly 4 surgeries, did that bring up any kind of emotions or fears, like bringing you back to kind of the birth or kind of worrying about that?
Yeah. I remember being very emotional from like May to, I had the UDS testing done in July. So from May to July, I was grieving the loss of my uterus and the loss of something that like we see as, our womanhood, our womb. And also just fear of, I have been doing so much work to lose postpartum weight, and I've been feeling so strong and so capable, and then having to go into a major surgery that's going to require quite a lot of bed rest and recovery. So like mentally, that was really hard to prepare for. I did a lot of visualizing exercises that the surgery went really well and there was no complications and everything. So like I went into this kind of the same way I went into birth, visualizing the optimal outcome and really focusing on that instead of like thinking about horror stories or trying to find the horror stories. I really tried to focus on the positives, knowing that like I'm really good at educating myself, but like I know that I can like spend hours down wormholes that I don't need to. So mentally, I really tried to prepare. When I found out I was keeping my uterus, I was like, okay, great, this is amazing. And then the thought, like, my husband and I have had some conversations, like, can I even conceive again? Like, do we even want more kids? Because we haven't even thought about it because I've had a prolapse. So like, there was no way my uterus was ever going to be able to hold another child. So, we've been having some conversations about it, but like, can't even fathom that because we have to focus on my healing. And then just the like mental drain of, not being able to work out, not being able to have sex, not being able to have orgasms. We'll get into that. You're not allowed to have an orgasm while you're healing, even like self-induced through toys. Apparently that was the first time I had asked that question.
Oh, is this what you posted yesterday? You got sex shamed?
I had asked my list of questions on my phone. We're literally sitting, I am in a OR bed. We're about to wheel into the operating room and they're like, do you have any questions? I'm like, I have a lot, but they're all about like post-op. And I was like, do you want me to ask now or after we get it? They're like, well, you're probably going to be pretty out of it, so you might as well ask now. So we're literally sitting in the hallway. I have a team. I had 4 surgeons in my operating room. So I have 4 surgeons around me, the anesthesiologist, and I'm asking questions like, when can I lift again? Should I start walking right away? And then my last question was like, am I allowed to have a clitoral orgasm? They looked at me and they're like, what? I'm like, I put myself to sleep most nights with toys. So like, this is very important to me. And they were like, well, your uterus contracts in an orgasm. So like, probably not. Like, let's just wait until the post-op appointment. So when I went in for my post-op appointment this past week, I asked if I was cleared, and she's like, "Oh, I remember you now about the toys." Like, yep, that's me going home to my vibrator.
But I wouldn't even think to ask that.
Yeah,
No.
And then I'd be like,
No.
I'm gonna get in trouble.
I don't know. Yeah, and she said she had never gotten that question before, so like clearly nobody else is worrying about using their toys for surgery.
That's great. Let's see. Well, you spoke a bit about how you did prepare for the surgery mentally and emotionally, and the recovery being so long, like not being able to stand, not being able to move very much. How did that affect you as a mom, as a partner? How did that go?
Yeah, so I think we knew going into it that like I would be on bed rest. I think my husband really knew, even if I thought I was going to be up and moving sooner than I actually was. So my husband has been an absolutely super dad. You know, he normally cooks for our family dinners, and I was able to kind of pre-prep a lot of like breakfasts and lunches before surgery. So I did a lot of freezer meal preps ahead of time, but he's been, you know, getting the kids ready for school, driving them to and from school, making sure that I had all of my like beverages that I needed before he left to drive them in, bringing me all of my supplements, bringing me all of my like anti-inflammatory drinks like turmeric milk and tart cherry juice and stuff like that. So he's been taking immense care for me. And then something that I wasn't prepared for, but I have been talking about in some of my post-op videos, was they tell you that you're going to need to take a stool softener. And that's something that most women are aware of, because you need to take a stool softener after birth because you get constipated and then it's hard to poop. But after surgery, if you do not take a stool softener, you're going to be in the most immense pain. And so because of where the sutures are, again, I have all this tailbone pain, but pooping was worse than giving birth. I would rather give birth because every time you poop, it feels like you're giving birth. So like for the first week, I would say pooping was the most excruciating thing I've ever experienced. I would need my peri bottle to be able to like relax my muscles. And then I was howling and moaning as if I was giving birth. Like the pain was so excruciating that I needed to like vocally yell just to get through a poop, which was mind-blowing to me. But so like stool softeners, I was given like a Clear Lax prescription, and then I was drinking magnesium calm for at least 2 to 3 weeks. And
but were you even feeling that going to the bathroom, going poop, you were even feeling that excruciating pain with the stool softeners?
Yes.
Yeah.
It's just like, as it goes through your intestines, and then as it like passes the sutures, it's so excruciating.
Yeah.
And then because of the rectal repair, there is there's a vaginal wall suture for like to fix the rectum. And they put your rectum back. I actually don't know the exact, but like when they put your rectum back in and your bladder back in, I don't know if they actually like suture anything back into place. Because like, I don't understand why they would just like cut into your vaginal wall, push things back into place and not worry that they would fall down. Like they sutured my uterus. So I feel like there's more sutures in there, but yeah, pooping was so excruciating. That was the only thing I was really not prepared for. And so I have been talking about it in a couple of my videos just to prepare some women, like take your stool softeners, use your peri bottle. I remember probably like at the 3-week mark, I came out of the washroom one day and my son Rylan goes, "Mommy, you didn't yell this time." Like they just heard me screaming for like the first 3 weeks, which was so vulnerable.
Yeah, I bet.
I'm so glad I've had my family, but it's really, really hard to have your kids see you in such like a vulnerable position.
Well, you know, now that you say that, I remember, obviously on a different scale, but there was a woman that I knew. She had 3 boys back to back. And I don't know at what age her kids were when she got the bladder repair, because throughout their whole life, they had never seen their mom laugh. Because she couldn't, because if she laughed, she would pee her pants. She couldn't run, she couldn't jump on the trampoline with them or anything. And so you don't really realize how much something like that impacts. Actually, we just did a podcast right before this with a woman who is a periodontist. And we were talking about people who that have like gum disease and, you know, don't like the way that their teeth and stuff
anything
like
with their
so
teeth.
They won't smile. And you don't realize how much it impacts your everyday movements or life, and then how it trickles down to your family as well, and what they don't see anymore or they've never been able to experience with you.
Yeah. My daughter loves to run. She is going to be like an amazing runner. She's built like a tank. Like she just like trucks down the driveway. And she always wants me to run with her, and I can't. And so that was like the hardest thing over the last few years is she'll go, "Oh, Mommy can't run with me." And like hearing her say that has been so hard. My husband, for my birthday last summer, got me not a road bike, like kind of like a gravel bike, because we live out in the country. And he's like, "So you can bike beside her." I'm like, "Babe, how do you expect me to sit on a bike with that?" Like, I can't, like, I don't even, when I was sitting normally, I would never sit straight down because I had so much organ sticking out that it was just uncomfortable. I was like, there was no way I was going to sit on a bike. But he was trying to do something kind for me. You know, she loves running. You know, you can ride the bike beside her. And I was like, it doesn't really work. And this was before we knew I was having surgery. So that was really, really hard. It's just like seeing my husband being able to like physically do stuff with my kids that I can't do. I have a couple of videos on my Instagram and TikTok with like my husband doing workouts with my kids, and I'm doing like my workout in the gym while they're running around outside. So it's been very hard to like not be able to like physically participate in my very active family.
So will you now be able to, or do you not? No.
Yes. Yeah. So I'm going to take it slow in terms of healing. Like, I'm not going to try to run tomorrow. I can barely walk for 15 minutes on the treadmill right now. But I am hoping that like at least in a year's time, I will be able to start training my body to run again. Okay. So I'm going to give it at least a year to properly heal my pelvic floor.
And do you have to go and see a physiotherapist still for?
Yeah. So I'm starting pelvic floor physiotherapy next week. And I see my osteopath the week after. So those are kind of like my priorities for the next 3 months.
Good. Wow.
So you just had your surgery on November 18th and you're in the healing phase. What has this recovery taught you about patience, self-compassion, and your body in midlife?
I think what's interesting about this recovery is the other like young comment that was made was when I got out of surgery, it was supposed to be a day surgery. I was supposed to go home the same day, and I was in a lot of pain. And after surgery, you have a catheter in. And one of your goals after surgery is you have to be able to void your bladder twice successfully before they'll send you home. And so they tried taking the catheter out, and I couldn't even walk to the washroom without assistance. And when I got to the bathroom, I was shaking and I was in so much pain. I couldn't relax my pelvic floor and I couldn't void. And so they let you try again, like maybe an hour later, still couldn't void. And I had a full bladder because they also fill your bladder with saline. And so after the second time not voiding, they put back the catheter and they're like, we'll keep you overnight for observation, but we'll send you home tomorrow morning. And I was like, okay, but like, what if I can't they're like, we're not going to take the catheter out. Like, you're going home with the catheter. And I was like, what? And I had no clue. I was like, I don't want a catheter in at home. And so I had like booked an appointment 3 or 4 days later to go into the hospital, have it removed. They tried again, couldn't void my bladder. I was in so much pain that I couldn't relax my pelvic floor. And so I had Kathy the catheter in for a week and a half. And when I was finally able to get rid of her and void my bladder, I was so proud of myself. It's just like, I'm an overachiever. So like being told that my body is not okay is not fun. So I was it's very frustrating. Thankfully, with my MS diagnosis, I have had to learn to be kind to my body. I have had to learn that like I am in a partnership with my body, that I'm not in a fight, that I have to listen to her, I have to work with her. And so just all of these things will teach you that like your timeline is not like, just stop having timelines and listen to your body as you go. So me expecting to be all better in 2 weeks was ridiculous. Having a better idea of like most people take 6 to 8 weeks for the pain to completely subside. That makes more sense. So I'm learning to again listen to my body, not get frustrated with her. I'm also learning that like it's okay to ask for help. So I went into this, a lot in a much better mindset than post-birth. I've asked for help where I need it. I can't even lift laundry baskets, so like my husband has to carry them downstairs. But it's just me saying like, hey babe, I need you to carry the laundry basket downstairs. And then he'll just go and do the laundry. Like it's not getting done the right way, but it's getting done. And so it's also like, it's relinquishing control. But like, this is something I learned after the birth of the kids. Right. So like everything I've gone through is teaching me a little bit more. And, asking for support. I actually stayed at my parents' house because we were closer to the hospital for a couple of days. And like I was waited on hand and foot. And so it's so nice to have the support. It's so nice to have people actually truly like nurture you when you need it. So I'm not ashamed to like ask for support and help when I need it. So that's definitely been a good lesson. But in terms of patience, like I don't think I'll ever truly learn patience, because it is very frustrating to be bedridden for this long. It's very frustrating I call it like I was bed rotting. Like there was only so much reality TV I could watch. I've read the entire, I have it in my, I've read all 5 books of the Akatar series because like I needed to do something else other than watching like Netflix or Prime. So I got back into reading fiction. Also, I was working the entire time because I work remotely. I was taking meetings from my bed and my coworkers are like, are you crazy? Like, my brain's fine. I would rather work, like I can work from the bed. The minute this meeting is over, I'm going to go back to being horizontal. Like I sat up for 30 minutes. Like I'm good.
I think that's part of what makes it so difficult too. Like when you like you said that you wanted, like you thought you were going to be fine within a few days or whatever. And like mentally you feel like, no, I'm fine. Like I feel fine. I'm ready to work. I want to get back to the things around the house, but your body can't do it. And especially for people who are active and people who are used to kind of doing things, it's difficult to then stop. even though it's
Yeah.
necessary.
I think the funniest thing was when I went to get the catheter out, the nurse goes, um, so are you off for 6 weeks? Like, are you enjoying having the time off? And I laughed. I'm like, I'm not off. I'm like, I have a meeting in an hour. Like, I'm going to take it from the car on the way home. She's like, what do you do for work? I'm like, I work remotely for a Web3 marketing agency. But like, yeah, I can take calls from the car or from my, like, it doesn't matter. And I would much rather stay on top of my client work than have to like catch up after 6 weeks. So yeah, it was the same when I was diagnosed with MS. I was back to work a week after, and that's not for everyone. And it's not to say like my husband will probably like make a comment like she doesn't really know how to rest, but like I have been in bed, I have been reading, I have been resting. I just need to exercise my brain and make sure I don't feel like I'm cognitively declining.
Yeah, I get that. Everything that you've been through with the pelvic organ prolapse and everything, is there anything that you wish more women knew about pelvic organ prolapse, especially those after childbirth or even entering into perimenopause and menopause?
I think the biggest thing that I didn't know was that sometimes surgery is your best option. And so if I had known earlier, like in 2021, when I had gone in to get fitted for the pessary, if I had been told that, you know, if my ligaments were destroyed during birth and there was no way that I was going to be able to strengthen the vaginal wall muscles to be able to lift things back in, if it was so bad at that point and I had had the surgery done then, it might not have been so extreme.
Yeah.
Like I had 3 surgeries in one, but maybe it was just the bladder back in 2021 and I was only going to have a cystocele instead of the 3 in one. So I wish more women knew that surgery is not failure. I think I was thinking of it as failure, that like I'm not strong, I'm not doing my exercises, but maybe surgery is the only option. And it increases your quality of life. Like the fact that I now I can wear a thong again. Like that's going to be very exciting after I heal. I can wear normal underwear. I could possibly have a tampon in instead of, you know, wearing period underwear. Like there's certain things I can, you know, learn to run again. So like my quality of life is going to increase. I'll be able to do things that I haven't been able to do because of the surgery. So I'm not seeing surgery as failure. I'm seeing it as something that, you know, we haven't really had that option. And sometimes, you know, especially if you're in a holistic world of health and you're into like a natural world of health, you might see surgery as a failure. I don't see it as that anymore because it's going to be able to provide me with a great quality of life.
Right. And I think there's so many, they've come so far in terms of like even bladder prolapse that is quite common. They can do it in so many different ways now. And you're not you're not out for a long period of time. And I know of a lot of people who are actually on a wait list to get the bladder, what do you call it, bladder repair? Or
cystocele?
Is that what it's called? Cystocele?
Yeah.
Yeah. And these are also women who are in their late 60s that are now experiencing it, may have had kids, may not have had kids. Where I have actually seen a couple of things brought up is in Alberta, if you have a bladder prolapse, you're given a video that you have to watch.
Okay.
And the video apparently is very positioned in a way that this is actually your fault. This is something that you did wrong. These were things that you should have been doing beforehand. It's awful. It's awful.
Yeah.
Which is really sad to hear.
Yeah. And not enough women are talking about their prolapse or what they're doing. Like not enough women are talking about pelvic floor physiotherapy or strengthening and stretching exercise, relaxing exercises. Nobody's talking about the surgeries. Nobody's talking about the healing. And so, yeah, it's like with anything with our bodies, whether it's a health diagnosis or whether it's an injury, it's very hard to like not think it's our fault or like could we have done something better. But again, like we only see things in hindsight, and we have to be patient with ourselves wherever we're at that moment.
Well, and I think even with the bladder prolapse, it goes as far as and it's more my exposure, but it goes as far as like, oh, every time I jump or I can't skip because I'm going to pee my pants. That's about as far as it goes. No one else talks about anything else other than that. Maybe you'll get a couple of conversations about having to go and see a pelvic floor therapist and get a bit of work, or talking about Kegels, but that's about as far as it goes.
Yeah, and then not enough is done, and it depends on your pelvic floor physiotherapist. I have seen maybe like 10 different pelvic floor physiotherapists, and some will make you rely on them so that you have to go in for appointments. Some will teach you what you can do at home. And it needs to be a combination. You need to be able to work with physiotherapists, but you need to be able to go home and know exactly what to do on a daily basis to relax your pelvic floor and strengthen it, what tools you can use. Like I finally found a physiotherapist who taught me how to use a wand properly so that I can release my sacrospinous ligament on my own, that I don't have to go in for manual release. And so when you're going for physiotherapy pre-prolapse, and I think every woman should go for pelvic floor physiotherapy, whether they've had children or whether they are experiencing a prolapse, because it's a proactive, if you go to massage therapy once a month, you should be going to pelvic floor physiotherapy. And you should be dating them. So you should be dating your physiotherapist to make sure that they're the right fit. Ask them questions in terms of like, how do they work with their patients? What type of exercises are they going to give you to go home and work with? Are they going to, make sure that they are checking you whenever you're going in to see if you're actually getting stronger or you're actually able to relax your pelvic floor, because you need to be able to do both. I would date a pelvic floor physiotherapist to find the right fit. And make sure that you're not just like reliant on manual care, once a month.
I guess as a final question, if a woman listening feels like something in their body isn't right, but they've been dismissed or been told, oh, just go do this, you'll be fine, what would you want her to hear from you today?
So in Canada, I don't know what the kind of the process is anywhere else. You can book a physiotherapist, a pelvic floor physiotherapist appointment without having a referral. Some places might need the family doctor referral. So like go to your family doctor or book a physiotherapist and say, I'm experiencing this. What are your recommendations? They will need to, a pelvic floor physiotherapist will need to manually examine you. So you have to, a lot of women need to figure out that like you will be taking off your pants and, spreading your legs for them. And they will be asking permission to manually examine you because they need to feel the strength of your pelvic floor, and they need to be able to feel if you're actually able to relax it properly. So I think that's what a lot of women don't know, is that you have to be able to do both. And sometimes that manual exam, they need to be able to feel your muscles to see if you're doing it properly. And then just like speaking up for yourself. If you're going to see a pelvic floor physiotherapist and they're saying that there's not any really issues and they're examining you lying down only, have them examine you standing up. If you're only experiencing pelvic floor prolapse symptoms, if you're only feeling like downward pressure when you're standing, have them examine you standing up. That's the sign of a really good physiotherapist, is they'll examine you standing. Because your prolapse might only be presenting with that gravity, with that downward pressure. And they should also be examining you if you're physically active, doing squats or things like that, so that like they can tell you whether or not you are properly bracing yourself in physical exercise. So just like speak up, find the right partner, and find the right healthcare team that will really support you. But don't let it go longer. So like learn from my mistake, I was in the depths of twin motherhood and I let the prolapse go too long. If it, it's something that can get worse, and it's easier to address it when it's still a lesser grade.
I think you are like the true sign of resiliency. Everything that you've been through, and I can't even remember when was it that you were diagnosed with MS?
2014. So it'll be 12 years. Yeah.
Okay. I've probably known you since like 2009,
yeah,
something like that.
Yeah.
Okay.
Yeah.
You've been through a lot.
Yeah.
Yeah.
And the one lesson that I've learned, so every single year I pick my core desired feelings for the year. And I had picked delight, vibrant, because I want to feel vibrant in my body. And then I had picked unshakable, because I obviously I want to be unshakable. And I can't remember what the other one was. And I told my husband over the holidays the words. And he's like, what were your last year's words? Let me just check. And I had said last year, 2025, I wanted to be magnetic. I wanted to be challenged. I wanted something, and then two others. But the important one is I wanted to be challenged. I wanted to challenge myself in building some new streams of income for myself. But instead, I manifested challenge. We had quite a challenging year. So when I told him my one of my words was unshakable, he's like, no, that's out.
Yeah.
So
not like a dare, not like I dare you to shake me.
No, the universe is not going to shake us this year. So unshakable is crossed out, and the new word is ease.
Is what?
Which
ease. Good.
I am calling in a life of ease.
Good for you.
This year. So
good for you.
It is so important. No matter you can be a resilient person, but stop manifesting.
Yeah, don't make it harder.
Yeah, so I am calling in ease this year instead of unshakable situations.
Speaking of other streams of income, you have a journal, don't you? Is it a journal?
A planner? No, it's a planner.
Right.
So that's what I was talking about. Is I have this entire planning method at the front where you pick your core desired feelings, your values, you do a life audit, and then set lifestyle goals. But that's where unshakable is now ease. And
crossed out.
Yeah. So
good for you.
Have your realistic partner take a look at your core desired feelings. So so I launched, I've had it for a few years, but this is my first beautiful hardcover one. So I launched it and I still have several 2026 editions left over. So it's just essentialplanner.ca if anybody wants a nice hardcover planner.
Good for you. That's awesome.
Yeah.
And if people want to follow you on TikTok, Instagram, what's your handles?
Yeah, so I'm doing the Restoring Me series where I'm talking about, so there's lots of episodes, me prepping for surgery and post-surgery. So on Instagram, I'm at Robyn Pineault, Robyn with a Y and Pineault. And then TikTok, it's Robyn.Pineault because someone already had.
Oh, yeah. Okay. There's more of you out there.
Yeah.
Well, thank you for coming on and sharing your story and enlightening us with so much of everything that you've been through. So
yeah, I appreciate it. Thanks for sharing my story.
Yeah.
Thank you so much, Robyn.
We'll talk to you soon.
Thanks.
Thank you. Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!